So question 3 is about alpha. Alpha is something that researchers choose. Okay. If you are dealing with something really serious like medication, you probably want a low alpha because alpha is like the threshold for when you change procedures. You got one medicine that kind of works with the disease. You got a new medicine that you think might work better. You want to set a low alpha because you've already got something that's helping patients. You don't want to make a mistake and by random chance go with a different medicine that is actually not as good. So alpha is set by the researchers. Using an alpha of 0.05, a p-value of 0.04 results in reject the null hypothesis. This is true, and I don't think there's anything else we have to say there. The null hypothesis can be rejected. We reject it. We're never 100% sure of our conclusions, but it's always a decision on the null hypothesis. We can reject the null hypothesis. We don't reject the alternative. We don't, yeah. This statement is false because the p-value is less than the alpha value. No, that's a good thing. That means we reject the null in favor of the alternative. This statement is false because the null hypothesis can never be rejected. No, okay, this is true. The alpha level depends on the sample size. That's not true at all. That's something that's set by the researchers. This statement is false because the alpha is always, no, it's not always 0.05. You can set it lower. This statement is false because the sample size is dependent on the alpha. It is not at all. This statement is false because the alpha level is set independently and does not depend on the sample size. That is true. With an alpha of 0.01, a p-value of 0.07 results in rejecting. That's false. The p-value needs to be less than the alpha. The probability of getting these numbers, getting this data, assuming the null hypothesis is true, is 0.07. They said their threshold for changing medication is 0.01, so this doesn't pass their threshold. We don't change anything. We stay with the null hypothesis. It's false because the p-value is greater than the alpha. Indicates the null hypothesis. It doesn't necessarily indicate that the null hypothesis is true. It just means we don't reject the null hypothesis. So that's close, but I think there's going to be a better one. P-value is greater than the alpha results in rejecting the alternative hypothesis. Oh boy, okay, so I don't know about C either. It's either B or C, I think. This statement is false because only a p-value less than the alpha. Okay, no, D is correct. This statement is false because only a p-value less than the alpha results in rejecting the null hypothesis. We don't side with the alternative. We don't reject the alternative. I didn't see that. We don't reject the alternative, right? So that's the only true conclusion there. Oh, I forgot about D. Because alpha is 0.05, p-value is 0.1, means the null hypothesis is true. That is not quite true. It means we just don't have enough evidence to reject the null. We either reject the null hypothesis, the status quo, or we fail to reject the status quo. Okay? We don't conclude that the status quo is true. The only thing on trial really is the alternative, whether we have enough evidence for the alternative. The statement is false because a p-value greater than the alpha level only indicates that there is not enough evidence. That looks good. There's not enough evidence to reject the null. We don't say that it gives us evidence to conclude that the null is true. P-value greater than the alpha level indicates the alternative hypothesis is true. No, that's not true at all. If your p-value is higher than alpha, that means you don't have enough evidence to help you side with the alternative. Statement is false because the p-value is greater than the alpha only indicates there's enough evidence to accept the null hypothesis. We don't accept it. We either reject it or we fail to reject it.